Hey guys, welcome back. This is part 2 of my conversation with Dr. Bill Aydin. And if you haven't already, make sure you check out TV Gold's podcast of last week where I had part 1 of my conversation with Dr. Bill Aydin. And we continue.
But a lot of people always ask me, it's like the number one question I get about you. It's like, what is he specialize in?
So
it's a tricky question.
Well,
and
it's not a tricky question. So I think part of the question that we like to answer today, as a fully trained plastic surgeon, you are basically training in the whole face, neck, body, from pretty much your clavicle down to your toes, right? So then you decide if you enjoy operating on the entire body, you're going to do operations on the entire body. Mm-hmm. So you might do a facelift, nose job, eyelid surgeries, neck lifts, breast lifts, tummy tucks. You're going to do all of these,
and some people like to go to the same doctor. They feel comfortable with the same doctor.
And again, if you practice all these surgeries, you stay good at these surgeries.
Yeah.
But if you decide that you're going to pretty much only do liposuction or only do a tummy tuck, well, then you're probably not going to do the other operations well. There is definitely a truth aspect of it. Mm-hmm. You have to keep up with the practice of those surgeries. So today I obviously enjoy doing face and body procedures. So I do plenty of both that I can say I'm good at both of them, meaning both facial
he's definitely
stuff
good at the
and
body. He did mine. He did my tummy tuck that came with liposuction. Then he cut off my love handles. You're so romantic. And liposuction my bra fat, and liposuction my upper arms and my upper back. But then the rest, I lost the weight. Yeah, and then I did work. And now I could happily say that I like to work out. I mean, I'm not at the gym huffing and puffing, people, so just calm down. But, sometimes Bill and I like to watch TV together or something, if I'm going to watch something, and I'll just sit on, go to our living room and just do, my little own, I don't know, babe, tell them what I do. You see it. I do little, pulses, sit-ups, crunches, push-ups,
you definitely
squats,
come around to enjoy it a little bit
stretching.
more.
I love stretching. I mean, I could be talking to somebody and I just could be like this, out of nowhere, I'm just stretching because it really feels good. And, it's so funny because before, when I was heavier, I hated working out. I loathed it. I mean, he knew.
I mean, look, today you have to ask yourself why you didn't enjoy it, right? And whether that is because...
But I know why now. I know why.
Why?
I have the answer. My body physically was not enjoying it because it was a struggle for me. Wait, let me finish.
But what about at a younger age?
So I don't remember it at a younger age.
But that's my point. So the question,
I never got used to it.
That's the question.
For me,
today,
it was always an ends to a means to an end, or ends to a means to an end. Meaning, I was doing it to get to somewhere where I wanted to be, which was having a nice body. Before our wedding, I was always doing the treadmill, wanting to look good because you wanted to look good, So, but after I had kids and when I wanted to lose the weight and I would work out, it was physically a challenge for me. And because it made me struggle, it equated to me not liking it. But now that I'm thinner and I exercise, it actually makes me feel good. I actually feel, when people told me back in the day, I exercise because it feels good. And I just thought they meant as a mindset, it feels good. Now I realize that they mean that it physically feels good, because when I work out now and I stretch, I feel like chills, tingling.
Well, look,
my
you're going to get endorphins.
Pulsating.
You're going to get endorphins when you work out.
But how come I didn't get them before? Or maybe I didn't notice them?
I think so. That's the question to answer, right? Were you psychologically so against it to the point where even if it came, you were just
no, because I wanted to do it.
I
didn't like that. I didn't like to do it. And I was like, why am I going to force myself to do something when I'm just not happy?
So today when we're discussing...
Back then, I was I rather cut what I'm eating than exercise so much. It was. I'm just being honest.
No, I know that.
You were witness to it.
Look,
you saw it.
What we are trying to understand is, how do we get people from even younger age to be moving more, to be enjoying the journey of exercise, and at the same time to consider their health at a younger age. Today I may be practicing aesthetics, but we don't need the population to be in the
Totally.
obese category, where unfortunately leads to a lot of
Well, I feel like
health
there's going to be a
conditions.
shift pretty soon about the foods that we eat. I think people are being more cognizant of the oils that they're using, the foods that they're putting in their body, heavy metals, plastics, microplastics, things that are hormone disruptors. These are all things that, whoever's like on it, or at least that's into their health, they're being aware of these things. And I think we're noticing a lot of things that are coming into play now, like using Teflon for so many years and using fluoride for so many years and using certain things. So I think there's going to be a shift in people being advocate for their own health. And I feel like the younger generation, there's got to be, listen, I'm hoping for the best, I'm the type that sees it half full. And it's gotten so bad where, child obesity is like a thing of the norm. So I feel like the government should make a change. Every other country is making shifts in what they allow for the people that, eat their food. People are going to be their own advocate is what I'm hoping for with that. And I feel like hopefully there'll be a shift. If not, we in trouble. Well,
I think, the shift
because there'll be a lot of unhealthy people. And the thing is, when those unhealthy people start to suffer from their unhealth, I feel like sometimes that scares people into like really getting on the path of getting healthy. When they get scared. I was talking to my dad the other day and he was telling me how initially he first quit smoking after he had his heart attack. It scared him.
So aesthetically, so to speak, we went through a time where I guess as we started having perhaps larger BMIs in the sense that people were enjoying being perhaps a little bit heavier. The question whether that was by choice or by lack of choice, right? We started saying, well, plus sizes, there's beauty comes in all sizes. That
Which
is
is true.
That is true. The question of, is that higher BMI healthier? Today, not everyone has to be at a BMI of 20, but BMIs of 35, 40, where, or even 30 are technically unhealthy.
Right. So I
And
think it
so-
just comes to them to make the decision about how they want to live their life. And I think that's why people are celebratory of people at every BMI, because it's like, at the end of the day, they should make the decision. If they want the choice to be thinner,
from a public
they
health
should.
perspective, so here's the question though. From a public health perspective, same way that we treated smoking to be unhealthy for people, obesity in that sense is unhealthy. And I think you have to, through education, the problem was, here's the problem, for some, without the help of perhaps GLP-1s or some sort of a medication. So today, if you're diagnosed with hypertension, you can try to decrease your risk factors for hypertension, but at some point you start some medication for hypertension.
Yeah, right.
And if obesity is in the same category
Then you
where
should start medication.
you've done what you think is your best options to try to control and you can't get there, now you're going to treat it with GLP-1s usually to try to get to that point where you are not in that obesity category.
And let me just say, and they're beautiful and at any size, men and women, they're beautiful. As long as they feel beautiful, that's all that matters. But just speaking personally, I'm not happy when I'm heavier. I can't imagine that a person that's out there that's heavy wouldn't be happier like being thin and being happy in everything that you wear. I see sometimes people who are like just people that I know personally. Myself, I would struggle to find clothes when I needed something for a special occasion because it's like I didn't want to buy the large. I wanted to fit into the medium, and it's like it was a struggle. And then I would, be annoyed and it would piss me off. And it's like, if I could just be skinnier. So like, although I think everybody's beautiful at every weight because they're living what they want, I personally,
the inner beauty,
my mentality is like, I'm thinking if it was me, I'd rather be happier skinnier. I'm
again,
happier skinnier.
The inner
100%.
beauty is one aspect of it. From the external side, from the outside looking at it, you don't find someone who says, okay, I am 5'5" and 130 pounds. I think I'm going to gain 30 pounds. We're talking about non-muscle fat. I'm talking about just fat weight.
Mm-hmm.
Of course, today, if you want to put on muscle mass and work out and be 5'5", that's different. But we're talking about, let's say, non-muscle mass weight gain. Someone who's 5'5", 130, 140 pounds doesn't say, I'm going to gain 30 pounds so that I think I'm going to look more beautiful.
Right. That's what I'm saying.
Right.
So that I'm just trying to like call a spade.
If
Like that's
somehow their lifestyle, let's call it lifestyle,
Mm-hmm.
it's a balance of what you take in and what you burn out. So if your lifestyle now has left you at 170 pounds at 5'5", well, then, yeah, you're going to say perhaps...
Yeah, I was not happy at 170. I was not.
Yeah, that's what it comes down to.
It was a struggle.
Yeah.
So you have a practice, Aydin Plastic Surgery.
Yes.
You also have a med spa aspect of it, or a medical spa. Aydin Aesthetics.
Well, it's part of our practice. So today...
It's not a separate location.
Today, med spas are built out usually outside of physician offices, so to speak.
But that's not
so ours is a physician office that obviously does full aesthetics.
Such as
facial and body things. So that means injectables.
What are some services you offer at Aydin Plastic Surgery?
So injectables, using
Botulinum
toxins. We call them toxins, but basically you're using toxins. You're using fillers, which may be
a little zhuzh, Pete. Never hurt nobody. I do get Botox and filler over at Aydin Plastic Surgery. He did that too.
I did too.
I do too. High five it. High five it. Aydin team.
And then you can do obviously laser or radio frequency or ultrasound-based skin tightenings. You can do facials, which may be as simple as, basic
I love
facial.
the facials there.
Yeah.
They do great facials. The staff is
or they can be
amazing.
medical-based facials where you're using, a little bit of a peel. You're using.
Is there downtime with that?
They can be minimal. They could be only one day. They could be minimal amount, or so peels will be light peels, medium, or deep peels.
So, but is the face red?
So on a light peel, these are usually stuff you're doing at home. Right? Light peel is meant to be done at home. Medium depth peels are usually done by
Can one
estheticians.
make an appointment for a facial and then decide what she wants when she's there?
Usually what you're supposed to do and come in with a consultation first, where you're not really... When you want medical assessment and medical aesthetics, you don't have to do a treatment that day. You should really come in and be given your options and set what your goals are. And for different age group, it's going to be a different goal. And then be given all your choices and then really schedule. Can you schedule the same day? You could probably schedule same day, but the
so
idea
definitely
is,
consult better. Yes, that makes sense.
I think
Don't jump in head first.
consultation, understand what your options are, give us what you've done till now. And, I think educating the public, educating the client is the best thing that we can do. Today everyone reads something online, sees something online on one of these apps, and then runs to perhaps uncertified places to do them, right? They're running to people's basement to do things. They're running into... There is unfortunately a lot of
I know. I've heard some of the stories.
Stuff that's done. The whole point of why you're coming to a certified location is that we're putting our reputation on the line. It's our job to educate you, our job to give you the best quality product and treatment, and each person's goal is going to be different. Our job is not to push our agenda on you, but to really educate you, give your option. But that comes with the person really now deciding, okay, what is it that I want? Some people start small, dabble a little bit. Other people say, listen, I want a facelift, or listen, I want a tummy tuck. And that's their right to want to improve their body.
Do you do the threads? A lot of people ask me about the threads. What do you think about the threads?
So, we offer threads still. Threads... Again, do I advise someone to do thread? Well, today, if you are a person who's in the never facelift category, right, then you can consider doing a thread. Some people walk in and say, look, I'm never going to do a facelift. Sure. I might have enough loose skin eventually that
But they don't care enough to. Yeah.
That's okay.
Sure, totally.
I am a plastic surgeon. Will I ever do a facelift? I don't know. I may never do a facelift, let's say.
Oh, you mean on yourself? Like,
Well, obviously, meaning go to another one of my colleagues and get a facelift. Today, a lot of plastic surgeons will do online things
I may
and
get
say,
a facelift one day.
yeah,
One
if
day,
that's your cup of tea, you're going to do it. Today, I get
need one?
Botox. Today, I get fillers. Today, I do skin tightening devices, get lasers on myself. But will I do a facelift eventually? I don't know. I may not.
Do you think I need a facelift? Not yet.
Well,
I think I still look
so the
good.
question is, today is a facelift. Yeah, there are
Is 48
times.
too early? What's the average age people coming for a facelift?
It depends on your skin genetics. So today, if you have good genetics, you may not need a
think I have
facelift
good-
till 60. You
Yeah.
may not need it till 70. You may not need it to 50. And so all depends on one's skin genetics.
I have good genetics.
There are patients that are perhaps in early 40s, and if they're weight loss, they might have enough loose skin that their
I think
jowls may be
Dolores
deep.
got it
their
like
neck-
45, she told me.
Yeah, again, part of it is your skin genetics. Does everybody love their skin a little bit tighter? Sure. Does that mean they have to do a facelift? Not usually. And I usually will tell a patient, if it doesn't, if there's not enough, I'm not excited to a facelift.
Right.
I don't love the word mini, right? A mini is like, what is a mini?
Mini.
Right. What is a mini?
It's like a mini tummy tuck. Why would someone do that? If you're going to do it big.
I mean, there are unique times where someone perhaps in the tummy is all they need. A mini usually means lower abdomen. But in a face, like when you do a mini, you're like, it
But I
doesn't
know
really
someone who
excite
got a
me.
mini and then the bottom was tight and then the overlap, the top was loose and it just didn't match.
Right. So that's the other part of it.
And
If
it
there
wasn't
is-
fat. It wasn't, it's just,
right.
it just
If
didn't
there
match.
is enough looseness above, then you need a full tummy tuck. But on a face, the word mini, way back in the day, there was a company named Lifestyle Lift that would do mini facelifts under local anesthesia, and they went out of business because part of it was they were false advertising showing full facelifts and saying mini. Today, if I take a little mole out of your face and imagine it's in front of your ear and I'm taking out this mole, well, you better believe it's going to tighten your skin up because I took a decent sized mole, let's say, but that skin is going to relax. So the word mini, this is what I mean, is like, okay, you just removed a little skin. It looks a little bit better, but it's just only for a little bit enough. I guess the word is how long does it last? Does it excite us and all those things? And, that's why I don't love the word mini. It needs to have enough of a change, and it should last long enough for us to be excited that somebody has done the procedure rather than like, it's a mini, lasts me 1 year, 2 years.
So I've seen some facelifts where like in the beginning, it's like really crazy. It's like the way that they look, it's almost scary. But talk to me about the hand-holding process that happens after a facelift, because it takes...
So today, facelift has gone through big evolution, right? From the facelift of the 70s and 80s to facelift of 2000 to 2020s now, where we're doing facelift, has definitely changed. And it may involve, only skin. It may involve the deeper layers of the face. It may be under different terminology. So,
well, you were telling me that at the conference, people were talking about young people wanting a facelift just so that they can change the anatomy of their face.
So,
Is that true?
That is becoming a trend now. So today,
That's crazy.
you're finding people in their 20s and 30s doing some version of a facelift, right? Not because their skin is loose, but they're really changing their appearance a little bit. And part of almost similar to how you do a rhinoplasty. Today at 20 and 30, you are changing your nose because you don't feel like you like the way it looks. And today...
But I feel like a nose job's easier than a whole facelift. I mean, you're like lifting the face.
Perhaps in some fashion. I mean, today a rhinoplasty,
it's like bigger surface area.
Rhinoplasty is the hardest surgery we do.
I'm sure.
For
It's right
precision
smack.
for precision reasons. So So technically speaking, it is the hardest surgery you're doing because every millimeter of a result matters, so to speak, for symmetry.
Yes, it does. I can speak from
But
experience.
but people are doing these, almost like perhaps the eyebrow positioning. So when we're
okay.
talking about these lift operations, fox
the other
eye and
side.
things like that. So when
They
you're
could
talking
see.
about fox eye and lifting things of this nature, so these are the type of things that we're talking about. We're lifting it. Some people coin different terms for it, but usually they're minimally placed incisions, often in the hairline, where you're not seeing it. So the old terminology of facelift usually meant some sort of a cutting in front of the ear. Those were the
Right.
traditional incisions for facelift. So now you're getting these endoscopic, which is basically with camera, partially done with camera in the hairline type of incisions, where you're trying to manipulate the deeper tissues of the face, where you're not necessarily seeing an incision in front of the ear. You might have an incision behind the ear if you need some neck work done. But so these are done almost in a way to create a little bit of a lifted brow and lifted cheek look, where people call it a little more refresh and things like that. And when a younger person is doing it, it's part of, I guess, a beautification where they're changing their,
I get that. I guess that's not so aggressive. I was like, that sounds like dramatic, 20 and 30-year-old getting a facelift. But when you put it like that, I guess it's not really that big of a deal.
So it's
just a little
kind
modification.
Kind of a way
Yeah.
that you're thinking is just like if you did a rhinoplasty, now you're changing your, cheek balance and perhaps, and
I did a
you can
rhinoplasty.
use.
Yes, I did.
Yeah, I mean, look, today this is part of beautification process that if you don't love where anatomically things are in your face and your neck and your jawline and your lips, you're doing something about it.
Yeah. I mean, listen, it's about the glow up, right? So for like, let's say a non-invasive solution to someone who maybe didn't want to go through all that, you guys just recently got the CO2 laser, no?
So
Talk to me.
CO2
Is that-
laser,
is that true?
So we've added a few different modalities to the practice, and we're excited
Tina was
about
telling me
these
about
things.
the CO2
Yeah.
laser. She's
So-
like, Jen, you got to get on it
So it's a skin resurfacing laser.
to tighten the skin. Yes.
Both tighten the skin and remove some of the skin blemishes and damages. So today, if
Like
you
brown
have,
spots.
you can use it to remove brown spots. You can use it to change the texture of your skin. Often people have textural problems on their skin, whether it's from acne, whether it's from, large pores. And then it can also help tighten the skin in the sense that by controlled damage to the skin, you're stimulating the skin to have better
So how many
collagen.
sessions does it require for a patient to have? Is it like a facial, like you just get it once and then there's recuperating, or is it like?
So you can do a couple of different versions of it. You can do minimal downtime versions of it where you might end up doing 2-3 over the next 6 to 12 months, get a kind of a
How do you
cumulative
sell it?
added.
Do you sell it in packages?
So those are done in a package fashion. So when you use them in a less aggressive ablation method, so to speak, which means we're not burdening you too much, then the downtime is
want
only
that.
for
Right.
1-2 days. The response is good, but it's not as deep as so the traditional CO2, if you want to call it, in the original days were fully ablative. You had 2 weeks of downtime. You were burned out, but you had an amazing response because it was that much downtime.
Right.
But most people didn't want that downtime. Most people couldn't hide away for that long. So then came the fractionated method, which was really using the laser beam kind of not as a full solid
I
in
feel
between.
like I've done something like that.
So we've done fractionation with you, not CO2
Remember
based.
that one time around Halloween and my face was so red? It was a vampire facial, maybe it was. Wait, not vampire facial. What do we call that? PRP?
So those are microneedling devices,
facials.
and then using
No, they put the blood in my face.
correct. So then you use the PRP to help heal the
take your
skin.
blood
Correct.
and then they spin it to get the good cells. Well, you say it.
So you're using the plasma-rich platelets, basically.
But where do you get the plasma-rich platelets?
From your
the
blood.
That's what I'm
Correct,
saying.
yeah.
So, yes. So they take your blood, a nurse will take your blood, and then they spin it, and that they get the plasmas, and then they really aggressively microneedle your face.
So now we have
so
those
that they can
options.
deposit
There's-
it back in.
You have exosomes, which are basically these cell products that are, we call them PRP on steroid. And then you can now, the new things people are
Do you
using.
sell those products? What is that? What do you mean when you said they're products?
So you can do that with microneedling using exosomes for...
What's an exosome?
So these are the cellular byproducts that are help kind of a skin tighten better and regenerate better. Almost
So like a
little
cream, a serum?
bit. So it's a serum that we apply during the procedure, at the end of the procedure.
Got it. So that's what you're
Instead of
putting
your
back
own,
in.
correct. Instead of your own platelets. So what we found out with platelets and using them is that each person's blood has a different level of regeneration.
Oh, wow. Look.
So now these are lab grown products that are basically are stronger than your own platelets.
Oh, wow. Look at
your
that.
own platelet-rich plasma. And then now you have salmon skin that people are using, right?
I heard of salmon sperm.
Salmon sperm.
What does the
also,
salmon
right?
sperm do?
So again, used to help regenerate. So often you're
I
kind
just
of
wonder, how did they figure that out?
well,
Like, who sat there and was like, well, let
billions
me
and billions are
play
spent
with
in the
some
lab.
salmon sperm
Right.
today?
So billions and billions are spent in the lab.
I don't need your sperm. I got salmon sperm. Oh, that's
Don't put it
crazy.
inside.
No,
There you go.
we don't want any salmon sperm. But anyway, so, and also I want to talk about another laser you guys got. You got laser hair removal that I just did the other day.
You know, we used to offer laser hair removal,
Yeah.
and the technology wasn't that great. It wasn't, again, we use the term laser hair reduction, right? So
reduction.
that is the proper medical term because each person will have a different
Because then they're going to be like, look at that.
response.
Look at that one hair.
Right.
Look.
So each person has a different level of
Yeah.
response to the laser-based hair reduction. So the proper term is laser hair reduction. Some people might have so much reduction that they may never shave again. Others might have still some
Well, I
amount
think
that
if it's
grow, right?
even finer than what it was and easy to maintain, I think people are grateful. I mean, I know I
Of
was
course,
grateful.
yeah.
And I've done laser hair removal before where it was very
Laser hair
painful.
reduction. Yeah.
Laser hair reduction. Laser hair reduction before.
But lay people will call it laser hair
whatever. That's what they're going to
removal,
call it
I know.
after
Right.
people want it.
Right.
Anyway. And semantics, laser hair reduction.
Yeah.
So I remember having it once and it was extremely painful. And your machine did not hurt me at
So
all.
they have gone better. The technology has gone
It's
better.
so great. So if you
there
guys
was
need
a
laser hair removal, Aydin Plastic Surgery, give them a call.
So there was a while we just didn't offer because it just wasn't that comfortable. So you know, the technology has gotten better, and patients are now more comfortable that it's worth offering it. So sometimes we wait on a little technology to get better rather than just offer everything new. Just because it's new doesn't mean it's better or that it's comfortable or that it works well. So we'd like to
So
offer...
how do you discover which one to choose?
So we wait a little bit to make sure that the technology is somewhat proven so that, you know, that it's, you're not just selling something for the sake of selling it, so to speak. So,
Got it.
So it takes a little bit of time. You're trying to, you know, make sure it's a reputable company that's offering the devices. You know, some of these devices can deform people, you know.
I know.
And then in an untrained person's hand, these devices can be, you know, very disfiguring.
Right.
So you
it's
gotta
good
be
to have a
careful.
medical doctor
You gotta
on
be
the
very
premises.
Careful. Yeah, you got to be very careful
to watch
Well,
everybody.
not just medical doctor. Again, sometimes we have to realize there's all different physicians opening medical office, medical spas. You can go to
Well, a plastic surgeon. So yes.
dermatology and plastic surgeons are the core practitioners of aesthetic.
Got it.
And so you really
So it can't
should
just be any medical doctor. It could be anything you
I
want. It's a
mean,
free country. That's what Bill always says.
There
it's
is
a
a
free country.
radiologist up the street from me who does liposuction.
This is right. I mean, I know some dentists who do Botox.
There is medical uses for dentists to do Botox.
I mean, I don't know if they do it like for aesthetic, not for.
Well, and again, that's
but
the part.
To each his own.
We'd like people to really,
of course,
practice the craft that they really trained in, and not do these weekend courses and saying that I learned enough to do it, because it gets dangerous that way. So, but do your homework. Make sure that the place that you're going to has the proper training, but the credentials, and perhaps there's many med spas that are owned illegally in some states.
Well, I know in the state of New Jersey, you need to be a medical doctor to have one. It's not like New York. New York, you could just be a nurse, right? Or
no, New York as well as New Jersey, physicians need to own med spas. They have to majority ownership of it, but there are places that don't practice under these guidelines. So what is the benefit of a physician? Well, you better believe that I don't put my license without, a lot of thought into practicing it. So by putting my medical license and reputation on the line, I'm making sure that you're going to get the best possible treatment, where someone else who, some business owner doesn't really care as much.
Right, even though it's
they're in it for the money
profit.
part of it, right? We're in it to make sure that we give you the best possible treatment each time.
And you do. I mean, Bill gives his cell phone number to his surgical patients. I think it's amazing. He's an amazing doctor, and I always have the best feedback from you, babe. Yes. So that leads me to my next segment, which is you need to calm down. This is
I need to calm down. Let's see. What do I need to calm down about?
So it's not you need to calm down, my love. No, you never need to calm down. You're so much more calm than me. Are you kidding? Duh. No. So it's a Taylor Swift song.
Ah, okay.
It's one of my favorites of hers. I mean, I have so many favorites of hers. Sure. It's hard to pick a favorite, but it's You Need to Calm Down.
Okay.
The song goes, you're being too loud.
Oh,
It's like, it's kind of like a diss track to all the people who are just like annoying her online.
Ah, yes.
So she's just telling people like, you need to calm down. It's not that deep kind of thing. Right. And like, that's totally my jam these days.
Yeah. Well, this was at this meeting that I just went to also, where many plastic surgeons would get some hate online from whoever commenting on patients, why these people doing this, why is doing that. I think people don't need to participate in things that they don't want to participate. So
that's you need to calm down. Like sometimes people just need to calm down.
No, there's absolute truth to it. There is
they just need to she's like,
mind your own family and friends. As far as being involved in outside of that, today you can go watch a movie. If you don't like it, you can write your comment. But to take it to the level of, the hate that they're putting into it and everything else, I think it's part crazy. Of it is maybe we don't need to read comments as much. I think it comes down to us having to say, you know what?
I don't even listen. Sometimes, of course, do they come to my attention? I mean, shit. Some people even send it to me. Yeah, don't do that. I don't care. But when they do send it to me, and you become aware, like sometimes obviously we ignore so many. We don't answer. I barely see them anyway. But every now and again, I give them like a little shady, passive aggressive, funny.
Sometimes
they're like, you can't.
I
don't know. Once I forgot they were telling me this one joke like, you can't cook your own food. And I was like, okay, sorry, I'm too busy like cleaning my bathrooms, or just like make like a snarky comment like that. It's like just so funny. So my you need to calm down moment is people need to calm down of the fact that I'm a Taylor Swift fan. Okay? My husband knows very well that I'm a Taylor Swift fan. Tell him, babe, how many concerts have I gone to? I mean, maybe you don't even know. Do you know?
I don't want to know. How about that?
He don't want to know.
The reason I say I don't want to know is unfortunately the tickets are always sold in secondary market.
They are.
And that's the abuse in the system that that we don't get to talk about. And,
Well, she
hopefully
doesn't get
somebody
that extra
can do.
money, just so you know.
I understand she doesn't, but somebody's
And she's
better
trying
do
lots of
something
things
about
to
it.
block having
Right.
that happen, and it's just not working. So,
Right.
Supply and demand, babe. And I will say, I don't do that for anybody else. It's just
Right.
one. I'm allowed to have one thing. And I had some TikToks that I did where I was just doing some TikToks to some of her music from her new album, The Life of a Showgirl. Yes, her 12th album that has 12 tracks. Yes, it's on repeat and in order, no skips. So some people are a little annoyed. They're like, oh my God, aren't you too old to be a fan? No, actually, I'm not. Okay, this is my life, and you're too old to comment. Okay, so back off. You need to calm down. Okay? You're being too loud.
Yeah.
Yes. You just need
Calm
to take several
down.
seats,
Yeah.
she goes, and then try to restore your peace and control your urges to scream about all the people you hate. There you go. There you go. She's got a lot of words. She's a wordy. She's a wordy. She sings it in
You're
a
a wordy.
song. I'm a wordy, but I can't sing it like that. You saw. I just.
She's definitely
She's
talented.
a genius.
very
She's a
talented,
genius. And people no, I'm allowed to be a fan. And you know what I love about Taylor Swift is she's a fan. When she goes to the Grammys or she's at the VMAs, if she wants to stand up and dance for her people, she doesn't care if anybody's dancing or not. She's going to get up and dance. And that's my kind of people. Be yourself, okay? Everybody needs to take several seats. You just need to calm down. Don't worry, be happy.
She's definitely a good role model out of all the people that can be out there.
You say?
She works hard at her craft. I'll give her that. And
She had her Eras tour for 2 years.
Yeah, that's a lot of hard work, dedication. That is,
And you like Travis
to-
Kelce, right? We love you, Travis.
I'm a Raiders fan. I'm not supposed to like him.
That's okay. We can make exceptions to the rule. We can make exceptions.
Listen,
I was trying to get
he's a
tickets
very
to
good player,
He is a
and
good
yes,
player.
of
He's a good
course,
player,
yeah.
and he's a good man. Good, solid man.
When I enjoy something, I enjoy it as a joy.
Of course.
Not to be a fan where now you're a hater of every other thing.
Well, that's the
And
great
this
thing
is-
about being a Taylor
Right.
Swift fan. You don't have to be a hater on anything else.
Right.
So,
So
but I don't know if it's like that
I
in
like
football.
my sports teams, but I'm not turning around. So technically, let's put it this way: when you're a Raiders fan, if you were a diehard, so to speak, Raiders fan, you're supposed to hate everyone there in division. Like Kansas City was one of the teams.
Oh, really?
Right.
It's like
So-
Greek to me, dude. I don't know. I just know Taylor goes there. That's
right.
all I know.
Yeah, there you go. So meaning I enjoy a good performance by every player out there. But I'll say I'm a Raiders fan, but if whatever team deserves to win that Sunday or whatever team deserves to win that night is what I like them to deserve. So just because I'm rooting for that team, if they win it undeservedly, I don't feel proud to be a
Right.
fan of that team, so to
Yeah.
speak.
I mean, listen, I like other singers.
Right.
We're just maybe not as fandomonium with her, but that's a new thing anyway. And I don't care. I love it. I love it. I love it. I love it. And, hopefully she sees this one day. All right. So I feel like that brings us to the end, Dr. Aydin, unless you have anything to add. You've been such the chatterbox lately.
Well, thank you for having me, lovely.
I mean, hey, you're cute. You're cute. You're my husband for 23 years.
Let's hope
One
so.
thing I love about Bill is that me and him we're God-fearing people, and we both love our family so much more than anything that we're willing to put them first before anything else. Right, babes?
Thank you, lovey.
All right, guys. Until next time, this is TV Gold. Bye.